we got to 80 registrants, Hootie. So usually you get about a third of the people turning up. Amin and I are trying to transform that and get stronger turn up by coming on a few minutes earlier and start chatting about useful stuff, hopefully useful. But if anybody's got any questions, comments, anything at all, throw it all in the chat, throw it in the Q&A. We can take you off mic so you can actually speak yourself as well. So do feel free. We're going to be looking at that all the way through. So I've started recording. We're all set to go. So Hootie, tell us a little bit about yourself before you launch into your presentation.
Happy to. Thank you, both of you, for inviting me here. I'm really excited to just jump into this topic. So I'm Huti. I worked as an oral health therapist for 17 years. So I actually studied in New Zealand about 20 years ago, doing my dental therapy training, and then I did my dental hygiene training once I'd moved to Australia. And that was about 14 years ago. But I'm, aside from dental stuff, I'm a mum. I've got 4 kids. I'm currently 8 months pregnant with my number 5. And I share that with you because just to give you a bit of background as to why I'm doing what I'm doing now and why my perspective when it comes to professionalism and culture within dental practices might be a little bit different to other people's. So I stepped out of my dental career about 2.5 years ago to pursue coaching full time. And that's what I love to do. I've been coaching now for 2.5 years. Oh no, sorry, I've been coaching for about 4 to 5 years, but stepped out of my dental career. And I felt like they were quite separate worlds. And what I've realized recently is actually they really support and complement each other, which is where the conversation came up between myself and Amina and Julie here about how we might be able to do some things together, which is the first thing that we're doing together is this webinar, hopefully the first of many. And I really see me collaborating with other people that present on this webinar as well, because something that I love about what Amina and Julie are doing is really just networking, having a community feel, being able to, bounce things off each other, what other people could, their strengths and my strengths and all that kind of thing. So I love, love, love all of that. So I'm here to talk to you guys about elevating your dental practice professionalism. Okay, this sounds a bit dry, doesn't it? Like it kind of, I don't know about you guys, but when I think about the word professionalism, particularly now that I've been out of dental for a while, my first thought is someone in a grey suit stuffing down their emotions and going and crying in their car when something at work goes wrong. And that's not professional at all, but that can be what people tend to think of when we think of being professional, is that we have to maintain this facade when we're in our work environment, that it has to be a certain way. And while what I want to bring into this is to invite that professionalism really depends on the context of where you're working, what kind of practice you work in some practices the language is going to be different compared to another practice, and really knowing what your practice is, where you're working and how you fit into that and how it all works together in harmony, because it's when things aren't harmonious that we can be overly emotional, whether we are bringing our work life into our professional life or the other way around, and they leak into each other. We find ourselves in these really difficult situations, trying to navigate our way through it, not knowing what to do, feeling alone, right? And I'm not sure how long those of you that are on here listening have been in the dental industry, but after being in it for, pretty much 2 decades, I've had all sorts. I've worked in really beautiful community-based practices. I've worked in extremely toxic, unhealthy, unprofessional practices. I've worked for women owners. I've worked for male owners. I've worked in public. I've worked in private. And ever since I was a little girl, I've always been fascinated with how people react and respond, why people do certain things, why they present in a certain way. And I'm always observing while I'm in these situations. And I've been in some really tough situations myself. You can't not have that happen when you're working, particularly in dental. So not to put like a dampener on this conversation, but when you actually look at a dental practice, it's not set up for balance, generally speaking. Most surgeries are smaller than a prison cell. you're working in an isolated environment, you're in close proximity to people that can have very, very high levels of anxiety. And that is going to have a lasting effect on us, right? Besides what's happening at home, besides the stuff that's happening at work, just the actual environment of a dental practice is not usually set up for our balance, right? So it's really important to really just notice that, first of all. When you think about, when I first thought about this, I was like, wow, you know, if you were to have, say you're one of the staff that are working in the surgery and you've got your assistant or your operator there, patient comes in, they're extremely nervous, the procedure doesn't go as planned, you're in this small space, you've got to get through it together. They leave, they're unhappy in the worst case scenario. They go out, their energy then affects the receptionist. And all of a sudden, you've got to wipe the slate clean for the next patient to come in. And when you think about it, how realistic is that to actually happen 10, 15 times a day, depending on how many patients you see? So I think the conversation around support, professionalism, how you're actually encouraging your colleagues to be able to debrief after certain situations. That's just kind of a classic dental situation that all of us are going to experience at some time. That's not even a curveball. You know, there's so many things we could go into. So professionalism, first of all, I think is really depending on the context of the situation and the actual surgery itself. Like some surgeries I've worked in, not in front of patients, but it's been okay to use swearing in the staff room, say. That's been part of the culture of the practice. In other practices, you definitely don't do that. So you can still maintain professionalism with having some leeway within wherever you're working, right? So I would love for any of you that are listening to this, if you have any questions or comments, please put them in the chat. I want to make this as interactive as possible, even though I can't see you all. Whether you agree, disagree, if you have any questions about what I'm talking about, if you have any examples of maybe some tough situations where you've really felt your own personal professionalism not being able to be there. I certainly have. I'm sure everyone has at some point. And you're wanting some help around that, please put it into the chat, because the more I get that kind of feedback, the more I can tailor this to everyone that's listening. So why is professionalism so important? Right? Like I said before, it's not necessarily about how we only look and presenting. For me, professionalism really makes people feel safe. You know, when people come into a surgery, if they're feeling anxious or they've had a negative experience, or it's their first time visiting even, maybe they've had a great experience, but they've moved countries like I have from New Zealand to Australia, new environment, and being professional from the moment they walk in to the reception staff, to the nurses, to the operator, it makes you feel safe because it gives you this level of kind of certainty when you walk in that everyone in there is kind of having the same vibe, I suppose. And like I said, this can be different for different practices. When we aren't being professional and when we can let our emotions kind of override what is happening, when home life leaks into work life, which I'm going to talk about as well, for someone coming into a practice, that can make them feel really unsafe. It can make them feel like, I'm about to go into the surgery and open my mouth. How can I trust that what's going to happen next? I'm actually going to be looked after. How can I trust that what they're going to sell me is actually value for money? You know, it's so important that we have this idea, an open idea about professionalism, but actually what does it mean and what does it mean where you work? And how are you presenting in that way? And what's the message that your patients are actually receiving? So we've got looking at it from a patient perspective, and we've also got to look at it from working in an environment. You know, if you're in an environment where you're not people aren't being professional, and I'm going to give an example about this from one of the practices that I worked in, you don't feel safe either. You know, if you happen to make a mistake and you don't have someone you can go and talk to about it, you can feel alone. And then what are you going to do then? Because we're all going to make mistakes. Something that's really important for me is feeling supported where I work, making sure that because I was a practitioner, so making sure that my nurse felt supported and we were a team working together team's really, really important to me. Having my fifth baby, I'm part of a big family. I'm used to the different relationship dynamics, and it's important to have that team dynamic to make you feel like, first of all, that you want to go to work. I don't know if you guys have been to work in some practices where you actually just don't want to go there anymore for whatever reason. And I would guarantee if that's happened, there'll be a level of professionalism that is not present.
It's really level of support that's not present. Moral aspects of professionalism that, change that environment where we feel safe or not safe, isn't it? Like empathy and integrity and honesty and all these things.
Absolutely, for sure. And when those are lacking consistently and they're just not present, you don't want to go to work. Patients don't want to come into that practice. And then, these can be things that are overlooked when we're looking at businesses, because we can be focusing on the numbers and all of the other things, right? So when we're looking, sorry, my screen just went funny. When we're looking at feeling safe in a practice, it's not just for patients, it's also for us as dental staff working together as a team. I'm just going to have a look at this question. Make my screen. Do you want me to make my screen more bigger?
No, I was just mentioning that because sometimes when hosts have a guest on, the host turns off their mic and video, and then the speaker is naturally prominent. But Amina, I love our faces on the webinar.
Do you want me to put it on?
And so, no, I was just mentioning to any of the attendees, you can change what you see on your particular screen by going up to the upper right-hand side of the screen. And it's got view, and then you can click on whether it's a speaker or gallery, immersive, so you can control that yourself. So just to let everyone know that if they're sick of seeing Amina's face, they don't have to look at it.
Rude.
So the next part that I want to get onto, which I think is really, really important and something that I'm really passionate about speaking about, is emotional intelligence. Now, how I personally view emotional intelligence is our ability to understand our own emotions, in a way where we can begin to try and understand other people's emotions and their emotional state, to have a deeper understanding, to be able to maintain open communication. What I lead with this is it starts with us. So some people may think they have a high level of emotional intelligence because they can read other people, but that's only going to be to the degree that you have your own personal emotional intelligence, knowing where you're personally at any given moment. And the hardest time to pull on this intelligence is when we're very emotional, when we're very stressed, upset, or even elated and excited. It can happen both ways. And I'm absolutely not against emotions at all. I do a lot of work with people when it comes to emotions and emotional releases and somatic things that you can do with your body. But again, if, like I said before, professionalism could be the person that's kind of pushing down their emotions and then going and crying in their car. That's not professionalism. But neither is vomiting your emotional experience all over someone else, whether it's an outburst to a staff member, whether it's, a patient that's kind of letting out on you, because that's going to happen as well, particularly when they come in and they're already really, really anxious. They're kind of primed for that. Often if you find patients are having things that happen, it can be tracked back to them feeling really anxious as they come into the practice. So that's important to be aware of when people are coming into the practice. But knowing where you are and kind of the scale of it is really, really important. And I think it's unrealistic for us to think we have to maintain a specific way of being all the time, particularly when we've got challenging things going on at home. We do have to maintain a level of professionalism to the best of our abilities. And often what's going to influence that a lot is actually the team that's around us. And when we feel like we can go and talk to someone, this again can be dependent on the type of practice that you're working in. So, for example, one of the practices that I was in, something really challenging was going on in my personal life. And I actually opened up to the owner of the practice, told him everything. I needed to have time off. it gave me some space to not have to be at work so I could actually process what was going on in my personal life. And that was okay for that practice. Another practice I worked at, I wouldn't have divulged all of the information to the owner. I might have put it in an email just to let them know, to inform them. But I needed to actually ask and give some context to it because it required me to have some time off work. But if we feel like we're working in an environment where the owner isn't approachable, if you're one of the owners, it's so important to have open communication with each other in a practice. I mean, would you guys agree? Like working somewhere where you feel like you can't go and speak to someone about something that's really affecting you and it's coming into work and affecting you. If people have, breakups or whatever it is, it can really influence how you show up at work. As much as we don't want it to, home life and work life can really, merge into one sometimes. And we're not thinking really clearly at these times. So ensuring, I would encourage any practices that are on here to have an open conversation at the next meeting about how do you feel supported? What's going to work in the context of our practice? Is this something where we have maybe psychologists or coaches that we can refer you out to deal with it? Or is this more of an in-house, okay, this is this person's role. If you've got something going on at home, go and approach them first, or whatever it might be. But have the conversation for the current people that work there, but also for people that come on board. I love when I would start at a new practice and you'd have this, pamphlet, or not pamphlet, but a welcome package that has all these things in it. And to know that if something goes on for you, whether it's in work, out of work, whatever it is, this is the place that you go to, just gives some certainty for when you end up being in that really uncertain time. Just in order for us to feel supported, I think is really, really important.
I love that. It's making me think about Brené Brown's work around vulnerability as well, because what you're saying around that facade of professionalism and what idea we have about what that looks like, vulnerability doesn't tend to come into it. But when you come, I heard this a few years ago, and it's always stuck with me because it resonates to be true in most of the times. You've always got personality disorders out there that may not be true with psychopaths and things like that. But if you've got two people in conflict, for example, and one person fronts up vulnerable, the natural human response to that is empathy. And I think you're right. In that corporate environment, in the working environment, that's not the place to talk about and be vulnerable about the things that are affecting how you feel and show up to work every day. But if we do, maybe sometimes the things that we're fearing will happen. I'll lose my credibility. They won't see me as professional anymore. Maybe that's not going to happen because everyone is in the same boat in terms of having to get over their own stuff to be able to front up every day.
Yeah, and it brings me to this thought about when we've got a really cohesive team and then somebody in the team is a bit weak at the moment for whatever reason, they've got something going on, and the others know that and they can just pull in and support that person to help them through that period. Because no doubt if you're at a workplace for some length of time, several years perhaps, everyone's going to have a turn at some point because of a death, because of whatever. And I can remember being in a dental practice, actually it was the one we worked in, Huti, and I lost a baby during that period. And I shared that with a couple of people. Huti probably would have been the first one because she was the very experienced mum. She was my go-to. And a couple of others. And when I shared that, I learned that these other 2 or 3 people in the practice had experienced the same thing. And I got so much support. And then the next time I was pregnant, he said, don't tell anyone. Don't do what you did last time. And I was like, last time was fabulous because they all understood and supported me. Why is it frowned upon? Yeah. So it is really good if we can have that support factor happening.
Couldn't agree more. And it brings me to the point that for those of us that work full-time in these practices, you're spending more time with these people than you are with your families. You're spending more time with them than you are with your friends. So even more important to feel that if it fits the context of the practice, because some just aren't. Like I had an instance where I just burst into tears in front of the owner and he just walked out because he couldn't handle it. And
that's helpful.
I realized that he couldn't do that. But then I always had really great relationships with my nurses. And so she was there, and I pulled it together because in that moment I felt I needed to. But it would have been, everywhere's different. So I'm not saying go and tell everyone everything or hold it all in. You've got to really know. But I think the most important thing that I would like to invite is to have the conversation in a meeting, as to what it's going to look like. I had the same experience, Amina, and it was just the work people that I actually shared it with, because they're the ones that I was around at the time. So it's so important. And when we feel supported, we can be professional because we have an outlet for whatever's going on in that moment, whether it's personal, whether it's a patient's just exploded at us for some reason and it's really knocked us, or if you've got the stacking of these things, home life's a bit stressful, someone explodes at you and you're like, oh my gosh, this next thing that's coming up is really stressful. If you've got somewhere to actually let it out, then that's going to help you come back to that level of professionalism that's important for all the reasons that I spoke about before. And there's many, many more. But with your emotional intelligence, being able to understand yourself, and I would encourage everyone on here I'm so passionate about this work that I do with coaching, and is to learn more about your own emotions and your own emotional state and how it shows up. And we can ask for feedback from other people as well. Checking in with each other when we're talking about the idea of support. I remember witnessing so many times, because you can have different types of patients, right? So you've got the patients that come in and they're really the nicest pie to the operator, but they treat the reception staff like absolute crap. And don't underestimate, if those of you that are on here that are receptionists, the toll that takes on someone to have that happen to them out of nowhere, and how you deal with that is a professionalism issue, not necessarily pulling the patient up in front of everyone, but how do you react and respond to the staff member that's just been verbally abused? Do you just ignore it as in, well, that's just part of their job and it's going to happen? Or do you have someone go, hey, I saw what happened, how are you going? And just having that conversation, I think, is really helpful. There's so many things in the dental industry that we just accept. I didn't add into the part before about kind of the doom and gloom of a practice, but we get told all the time how much people hate us. I hate coming to the dentist, and it just is this accepted thing that we wear. And I think we've got to pay attention to how often these things are happening, because when you get the stacking of these things that are happening, that's when that's an opportunity for you to become emotional at someone or to do something that you really regret. And then, of course, in some instances, this can end up going down, lawsuits and things like that. So you're wanting to, keeping it all just looking out for each other, I think, is really, really important, obviously.
And I like what you said about the stacking, because that's huge. That's huge in relationships, intimate relationships too. If you don't resolve anything, it's one hurt stacked on top of another. But when your encouragement just to talk about stuff, say, I saw what happened there, tell me how it made you feel, or let's talk through it, or whatever, you are preventing that stacking, or at the very least reducing the intensity of it down. That's huge.
Yeah. And to be having that conversation with people that actually get it. Like, other people might say that people are so easily say things, right? Like, they're really rude to the receptionist, or they say, I hate coming to dentists, but you say that to someone who's just had a really, really crap day, or something's going on with them. It could be the last thing that happens. And having a conversation with someone that gets it, because everyone in dental will get it, is just helpful to feel like you're not alone. And it's when we feel alone, I think that's when we tend to have these outbursts, or worse, we hold it within. And I mean, dentistry has, I don't know if it still does, but it had the highest level of suicide out of all the professions for such a long time. And I think all these different elements come into it. So it's important to really prioritize conversations like this, and having a structure that's going to work within the practice, whatever that's going to be, but actually having a conversation, making a plan so that people feel supported, and asking if they don't, if there's any areas where we can improve. We're always wanting to improve on what we're doing in order to grow in practices, whether it's in our techniques that we're using, whether it's in our communication, whether it's, how we're actually presenting ourselves out into the community. We've got to be open to learning more and, inviting people like you guys in, like me in, to come and have conversations like this, just to open it up. Because for a lot of people, when they get into dentistry, they don't think about this stuff. They're wanting to come in and do the work, or they're going to be there to answer the phone. But the human aspect of it is there all of the time, and that's what's going to make it enjoyable. And all of us want to be working somewhere where we want to be presenting. We want to actually go to work. Being somewhere you don't want to go to work is horrible. And for patients to feel like they can come in and they're part of it as well. I think I was going to talk about it later, but I'll talk about it now. Values is really, really important. It's something that I love to speak about. And when you know what your core values are as a practice, it usually comes from the practice owner, and then it disperses down into the practice. When we have conflicts, often it can be where our values are conflicting, where it can be, this is my value, this is your value, we're going to battle it out to see whose wins. But when the practice is clear on what their values are, and they're actually attracting in employees that share the same values, and then patients that share the same values, there's this beautiful fluidity that comes in where you don't have to try so hard to warm up to people. It's just, when you walk into somewhere where the culture is really good, you just feel like you're at home, even if it's the first time of being there. So I think that's important as well.
And when there's that misalignment, it's really hard to change it, isn't there? If that alignment isn't there in the first instance, some people, and sometimes it will happen that people will sort of open their mind and become educated, and perhaps you will see eye to eye. But sometimes it can also be very, very difficult, and it will constantly be like this.
Yeah, I couldn't agree more. And you know it straight away when you go somewhere. But I would dare say that people that are on this call are, if not already there, on their way to being there, because I know that's the vibe that you guys bring. So would anyone have any examples of things, and even if you guys want to share, if we don't get any in the chat, of situations where you've been in and you haven't quite known how to navigate what's happened? Like, if you want to give me an example and we can maybe have a conversation about it, or you can pop it into the chat.
While someone's trying to put it in the chat, the first thing that came to my mind was when I was a young dental assistant and the dentist is freaking out in the surgery, and you don't feel like you have the answers for a start, but also the authority to actually speak up and say, why don't you go out and take a breather right now? And so for me, that's the first thing that popped into my head.
Yeah. How do we address it when we're witnessing someone else going through a hard time? I've spoken mostly about when we're going through it, but when someone we see that we're working with is challenged, how do you actually go about addressing it? It's such a good point, because a lot of this is going to be the dentist and the assistant, because they're the ones that work in such close proximity. And sometimes a dentist might not see anyone else in the practice all day if they're working, all that time. Yeah. So how do you navigate it? How would you guys navigate it? What would you say? What's some ideas? Because I don't think there's one way for it to happen. I think there's multiple ways. It depends. Some people just are not approachable, and it could just be the way that they are.
Doesn't mean your youth and your lack of experience, that you maybe you even know what the best thing to do, but you think this is not my place.
Yeah, I think at this time in my life, I'd be quite comfortable saying, okay, we're just going to sit the patient up. We're going to take a little break for 5 minutes and sort it out that way. Get somebody to come and stay with the patient, go talk to the dentist and sort out what the hell we're doing, if I really thought, And if we weren't far into treatment, I'd be saying, let's call it a day. We'll get them back. I'll tell them you're not feeling well, whatever. But as a 16-year-old dental assistant, new into the profession, do you think I would have done that? No way.
No. And the dentist wouldn't have allowed you to either. What do you mean set up the patient? Who the hell do you think you are? Rightfully so. They're the ones that, when you're only 16 at the time, keep going, sorry, Minnie.
No, that's exactly right. So in that situation, I would have just suffered in silence for sure. No doubt about it.
Yeah. But then after the fact, what's in the practice where there is a structure where someone can go to someone? Like, I witnessed this happen. and it is scary to call someone out, particularly when that's happening, but it's going to benefit that person eventually, you would hope. But I think, like I was saying before, if you've got a structure in place for when something like this happens, where you can debrief, I know I've came and spoke to you, about a couple of things that happened, and just talking to you was enough for whatever may have happened to get dealt with. Having that person, and you were the practice manager, so you were my go-to, and you were so approachable as well, for it to be able to be dealt with. If I didn't want, at the time, we can kind of be shocked when things happen sometimes, and we don't know how to respond if we go into a freeze response, or we're like, what's my place? And for some people, that can be professional, because you don't want to break that in front of a patient. That could actually, suffering in silence, as much as I don't want that to happen, might be the best thing you can do if you don't know what to do.
And I think one of the wonderful things too is, we talk about developing agreements between one another. And so after a stressful situation, if I was a nurse and the practitioner was very stressed out, and you could tell the patient was picking up on all of that, so you didn't want to be something that was repeated, to actually say, can we talk about what just happened? What do you want me to do to support you in that space? Because it's a big difference to doing something that you think is useful, as opposed to that person saying, I personally would like you to do this. That's me giving you permission. Therefore, I'm less likely going to be upset with you when you do it. It'll kind of call me back into my space again, my professional space again. And to have that conversation, what role do you want me to play with you in that moment?
Absolutely. Yeah.
I think one of the very common, or some of the common not great dynamics that are seen in dental practices is, the dentist and OHT relationship. Sometimes there's that lack of respect for people who are not educated about how that all works and don't have a real appreciation for it. So we see that quite commonly, and it causes a real gripe. And the other one is even sometimes the dentist, it's often the dentist, it's always the dentist. No, I'm joking. The dentist and the support staff, they don't feel... many well-educated people do, who are open-minded, value all their staff and give them the time and respect and understanding that we're all at different levels of learning here. However, we do sometimes see that kind of arrogance step in with a kind of hierarchy, and they're frowned upon, and the people beneath them, so to speak, in inverted commas, the support staff, they don't have the confidence or the know-how to manage these people that are sort of undermining them or making them feel inferior.
Yeah, definitely. And when we're talking about culture, that's something that's going to come up, right? Because if that's happening in that practice, if it's the owner, it'll be throughout the whole practice. There's going to be hierarchies all over the place. It's going to be very clear who's the boss, who's not, where your place is. But if it's someone coming that's new into the practice and they have that about them, when actually that doesn't fit the culture of the practice, that's really, really important to address, because that in one practice might seem normal. Patients will be used to it. That's going to be the way it is. But then in that one, it's going to stick out like a sore thumb. So it has to be addressed. And the conversation about teamwork comes in, and culture, and not just about the numbers and getting everything done. Like I've seen so much in dentistry where, along with what you guys are saying, where I don't want to beat up the dentists, but if they've got a procedure they can squeeze in, and then the nurse is going to be running late, and the toll that takes on everybody in the practice. Now, if that's how the owner wants to run the practice, it's their practice and they get to do it, and there's going to be consequences for that. But if it's someone coming in and that's not part of the culture, that it really, really has to be addressed. And there's a few things that I really loved in welcome packages, and actually got it at the practice when I worked with you, Amina, for the first time, which is not related to this, but it's kind of with it, is a no gossip policy. And I'd never seen this before in a welcome package at a practice that I worked at. And I read it and I took it really, really seriously. And it had in this part about it saying how much gossiping about each other negatively impacts the patients, negatively impacts the work life. And I read it and I really took it really, really seriously, to the point where people there would come to me and say, my nurse would come to me and say, Huti, I know you don't like to gossip, but can I tell you about this thing that happened? I just need to tell someone. So of course I said, go for it, share. But she knew that I wasn't going to sit there and talk about someone that was in the room next door, because that's deeply unprofessional. And it's going to happen. People are going to talk about things, but there's a way of doing it where we're kind of letting it out to let it out so we can share with someone, like I said before. But the important thing in that context, if someone was to come to you in this case, is how we're going to move beyond this, rather than just talking about what happened. What do we learn? What can we do next? Who can we go to help fix or rectify this? Versus just talking about someone behind their back. They walk in, you stop talking, and everybody knows what's happening, but no one's actually going to bring it about.
Yeah. And it's interesting. It's like so many things, and we talk a lot about the need for clarity, that if you get a dozen people working under the same roof in the same dental practice and you ask all of them, what does professionalism look like to you? They're probably all going to have different answers. And so in this practice, what does it actually look like? And have that as a kind of a brainstorm series of ideas and behaviours that get written up somewhere. So everyone in the current team, but also future members coming into the team, this is what professionalism looks like here.
I think so. And even things down to how you handle certain situations. I've seen, again, receptionists sit on phones literally in tears from someone abusing them on the phone. And they don't hang up because they don't want to get in trouble. So they sit there and take it. And I'm like, if it gets to the point where you are crying, just like, for me, I would say just hang up the phone and just say it got cut off. When you're at your max point, there's got to be a way for you to feel safe enough to just go, you know what, I need to exit. Like what Amina was saying before, if the nurse was in a situation or the dentist was in a situation where they didn't feel like they could, if their next move is going to compromise the integrity of themselves or the practice, just walk out, because it's not telling anyone in the room what's happening, but you've actually got to get out and just do something with it, or have these conversations openly, debriefing at each, whether it's a huddle. I love places where I've worked where we have huddles in the morning, and it's what went well yesterday, what didn't go well. So you have the opportunity for both conversations to come out. If something didn't go well, why was that? And it's started at this point, and then at this point, and it ended up in the surgery, but actually it started at reception, but it wasn't addressed, and just kind of letting it slide for whatever reason that may have happened. So there you go.
Talking about, having that cutoff point and safety mechanism with a disgruntled patient, when you're in those situations and you are supported by somebody else in the practice, like it's happened to me before, where the practice owners basically come and said, you're out, off you go, you will never speak to my receptionist like that. You feel so safe and so supported and so valued and appreciated. It's really important to have that type of backup in the practice and to feel very valued like that. And the other thing, jumping back a couple of conversations, was that person that comes into the practice and almost like a venomous snake, and they don't fit into the culture and they try to stir the pot. They are venomous and they need to go like quick as anything, don't they?
Yeah, I love this saying, hire slow, fire fast. That sounds kind of ruthless, but it can just take one person to come in and to be gossipy or to undermine people, and people that have this way about them just do it really in a real evasive ways, like that you don't even realize it's happening. So yeah, having a tight-knit team, it's not going to be as easily, you're not going to be as vulnerable as for it happening. And what you said around someone coming in and saying, hey, that's actually not acceptable in our practice, I'd like you to leave. If there's patients in the waiting room, they're going to respect you, the practice so much more, because that's the standard that you hold. That's the level of professionalism that you hold, that this isn't actually okay here. We value all of our staff members, and, be gone. So yeah, I think that's really important too. What was the next part I was going to get onto? So there is a technique that I have come across that I would love to take you guys through with you guys are saving this as a recording for people to watch afterwards, right? And it's something a bit left field maybe for some of you, but it works really, really well. And it's called heart coherence. You can call it a meditation or a mindfulness practice, but it was came about by this company called the Heart Math Institute in America. And they do all sorts of research around heart coherence and our brain waves and states of stress, and where we can get into a place of just nice balance and harmony. And stress is when our heart, the pattern that our heart makes when you've got it on a monitor, and the pattern that our brain makes when we're not stressed, they're actually incoherent. They go together. And the state of stress is when they're erratic and they're not synced up together. So this practice is actually something that you can do. It takes 3 minutes and it can reset your whole system. And I think if more practices had something like this up their sleeve, it's 3 minutes isn't a lot of time to take out if you've had an experience that's really knocked you, or if you're going through something at home. You can do it multiple times a day. I used to just go into the toilet and do it in the toilet. People didn't know.
Always wondered why you were taking ages, Huti.
Yeah, it's really supportive, and it's actually in America, first responders were taught this technique after they'd had quite a traumatic event. They could go away and do it, and I've got a monitor here actually, and you can they monitor your heart rate variability, which is the time between each heartbeat. So it's not your heart rate, it's like the time between each peak. And when the gaps between your heartbeats are the same, it's actually a sign of stress. So I think of it like people marching to war. When they're marching all the same, that's a sign of stress. And when you're kind of walking through a park and you're relaxed and you might go fast and then go slow, that's actually, I know it sounds kind of counterintuitive, but that's when we're in a state of not being relaxed, because you can actually have heart coherence while you're exercising, but that you're in a balanced state and that you're actually ready. If something was to go bad, you're more prepared for it in that event rather than when you're kind of marching along. So I thought I might just take everyone through it now for a couple of minutes, if you guys don't mind. It's really, really simple. So yeah, if I could just get you to close your eyes, I'll close my eyes as well and just talk you through it just for a couple of minutes. I'll just put, I was going to time it, but I think it's okay. Yeah, so I'll get you guys to close your eyes. I'll close mine. Everyone that's watching, you can close yours as well. And just to start off with, just take a nice deep breath in to your belly and just settle all of your weight and be present in this present moment. So breathe in and then breathe out and just let it all go. Now I want you to put your finger on your center of your chest, so just on your sternum. You can open your eyes if you want to see where that is, and just touch there. And now as you breathe in, I want you to imagine that you're breathing into the space that you're touching. So breathe in. And then as you exhale, breathe out of that space that you're touching. So this is our heart center. It's not where your anatomical heart is, but it's where your energy center is for here. So we're going to breathe in for 6 seconds. I'll count. So breathing in, 2, 3, 4, 5, 6. And then breathing out, 2, 3, 4, 5, 6. Breathing in, 2, 3, 4, 5, 6. And out, 2, 3, 4, 5, 6. Continue breathing in this way, imagining the air going into your heart center. With each inhale and each exhale, just relaxing into your body. Just keep breathing into that space. Now, while you're breathing into that space, continuing with the slow breaths, I want you to think about something, someone, or a place, or an event that you're grateful for. could be a person. Bring that to mind now and just feel how grateful you feel in this moment. Focus on whatever you're grateful for, continuing to breathe into your heart space, slow breaths, and then feel that feeling expand from your heart as big as you can throughout your body, beyond your body. Nice, slow breaths, thinking about what you're grateful for. All right, and when you're ready, you can open your eyes, come back into the space, and that was 3 minutes and 20 seconds.
It's so very relaxing.
Very relaxing.
I don't breathe deeply enough. I think I must shallow breathe all the time. I'm like, oh, what's all this? What's all this space in my lungs being filled up?
Breathing deeper into your belly or breathing into your back is helpful, because when we're not used to breathing in this way, and often when we're coming out of a stressful situation, we're having really shallow breaths, just changing the breath will affect your state immediately. But it can feel like almost like you're holding your breath because you're so used to this shallow breathing. So if you imagine breathing into your belly or breathing into the back part of your back, your lungs will naturally open more, rather than telling yourself, have I done enough? And of course, when we breathe into the lower part of our lungs, we're going to be taking in more oxygen, because that part of our lung absorbs more of it anyway, as opposed to the shallow breathing. So that's something that people can do, and you can look it up. They're called heart math. It's called heart brain coherence. There's lots of things on YouTube you can go and look at, but it's very, very simple, but it does reset your system. And I've had it with myself, where I've got my heart rate variability monitor. I've got a ring that I wear that tracks my heart rate variability. I've got lots of tech to measure all these kinds of things. So I like to see if these practices actually work, and I like seeing the proof of it, besides kind of, did it work, did it not work? And it really does. It can reset you. So things like that is other things you can have in your practice as well.
And I think every practice I've worked in the last 15, 20 years, there is always several members of the team who are, suffering from depression or anxiety, on meds, all that sort of thing. So it's out there and it's happening in your practice, whether you're aware of it or not. And these sorts of things can really help.
And as a manager or as a practice owner, or any person of kind of influence within, or authority within the practice, to have somebody there that understands these kind of exercises. So if there is a space of conflict or aggression and you're trying to get to the other side of it, to be able to bring people and go, okay, let's just take a few deep breaths together, let's do that exercise, and actually start let's get out of that highly reactive space. Let's balance ourselves, balance brain and heart, and function from there instead.
Definitely. Then we can come back to who we are, not reacting to something that we're seeing differently to somebody else, which is usually what conflict is. It's, I see it this way, you see it that way, I'm right, you're wrong. And, having something in the middle, because often when that happens, both parties actually want the same thing. They want the outcome. If it's between a patient and a dentist, both people want the best outcome for the patient. No one's sitting there going, I want this procedure to go bad. Right?
You hope. Who's in charge of your recruitment?
Yeah. But we forget that third perspective is really important to have. I think it's really important to have a key person in the practice that can be the person that holds that space, that has a high level of emotional intelligence, because they understand their own emotions and how to regulate their own nervous system, which is really, really important. for all the reasons that I said about before. And like Amina just said, there's going to be people that have anxiety and depression, even more so now than what there has been in the past, just with the nature of technology and our attention and how often we're pulled out of being in the present moment. That's something that practice really invites, is getting into the present moment, because anxiousness is fear of the future, depression is like living in the past, and we're not in the present moment. And anytime we're not here, we don't have the energy and the capacity for our brains to actually work properly, to think about what's the best way to go about this. There's usually someone around us in a dental practice that has their head on their shoulders, that isn't a part of the situation, that can be invited in because they're going to see it from a different perspective. So who's that key person in your practice? Is it a group of people? Is there people that, like if in a practice, I would be one of the ones that would go, I'm happy for you guys to come and talk to me, pull me aside, more than happy to, because that's my nature. I would guarantee that there'd be people in the practices, that for people that are watching, that could be, if there's a go-to person there, or if that's not the culture of your practice and you don't want the deep and meaning, not that they have to be deep and meaningful, but if that's not what you want, that's okay. What is the strategy going to be then for when something goes wrong? Have you got a psychologist that you can refer to, or someone else, so that you've got a clear pathway for when things don't go to plan? So that, like, yeah, if there's death in the family, that kind of thing. Yeah.
I actually think being a leader nowadays, be it a practice manager, be it a practice owner, you have a responsibility to learn a bit about this space and be aware. And it's the difference between being a really good leader and not such a great leader, is the whole self-awareness journey, the emotional intelligence, empathy, understanding how others are affected and how to help them.
And it's about recognizing your level of responsibility in that.
Yeah.
If you want great outcomes, you need to be responsible for your input into that. Yeah.
That's right.
Absolutely. And this is a health space. Dentistry is health. I think a lot of people forget that it's actually to do with your health. It's not just this small thing here. It's our health. And so it's mental health. And if we don't support all of us in the environment, it's just, people aren't going to hang around. You're going to have poor patient outcomes because things were missed or whatever it is. But that's definitely a strategy, because we had the outcomes for today's call. So one of the strategies that you could use is heart-brain coherence. Another one is having key people in your practice, having the open conversation. If you're the type of practice that is really about team and you want everyone's input, have that as being part of the meeting. If you really know, if you're a practice owner and you're on here and you know exactly what you want that to look like, then you set the tone and be the example for everyone else to follow. Like Amina said, leadership is mostly not about telling people what to do. There's a really big difference between being a leader and being a manager. And if we get a manager that's a leader, that's amazing, because managing is just, it can be just enforcing what's there. But a leader is someone that actually is willing to go first in a situation that is challenging, and they're going to be the example for other people to follow, which I think is really, really, really key. And it's a conversation that's so much more open to have now. Like, it certainly wasn't there when I started my career, and I had some really tricky situations when I first started out, when it came to bullying and getting me to do certain procedures that were not actually okay to do on patients and all that kind of stuff. I think these conversations can be had and invited in to make it better for everyone. Tips to create a positive environment, everything that we've discussed, but also for people that work there and for people that come in, depending on your kind of practice, having natural plants can't be in the surgery, obviously, because it's a no-go, but in the reception area, or some greenery, or make sure that your color palette is a calming palette if that's what you're wanting. Having it not smell so surgical if possible. People always say, oh, it smells like a dentist, and you can have essential oils if that's your vibe, or you can have whatever it is. Some places can be really calming, and other places can be deeply, deeply clinical, and that's actually what they want to have happen. I think it's not that it should be one way or the other. It just should match whatever the culture of the practice is. I've worked in, the last practice that I worked in was a holistic practice, and we had plants and we had essential oils and we had all that stuff that was great. But I also at the same time was working in another part of this corporate that was very kind of surgical, but neither of them I preferred the holistic one. but everything was in alignment, and the culture was quite cohesive either way. And that gave patients that safety, because it was the same all the way through. You didn't have someone talking a certain way and then another person using different ways of speaking. It was like people knew what to expect. And I think that actually affects patient outcomes as well when they're coming into that kind of environment, particularly if they're coming in for a toothache. We've got to show, empathy for people when they're coming in. And again, I learned it at the practice that we were at, Amina, when I realized when patients were disgruntled and unhappy and angry, you could nearly always track it back to a level of anxiety of coming in. And when I looked at them through that lens, I approached them completely differently. I would usually slow myself right down, particularly if they were trying to rush me and they're kind of being abrupt. I would just slow myself right down. I would calm down, and eventually they would calm down as well. But yeah, I think, what else was there here?
We often do feed off those around us, don't we?
Yeah, definitely.
And then we're always kind of subconsciously reacting to each other's energy. And if you both keep matching higher and higher and higher, it just keeps going up. So it does take one person to bring it all the way back down to a calm space again.
Mm.
Yeah, and trying to keep it as positive as we can. I don't think we can be positive all of the time, but in order to continue to grow and evolve, and for our practices to thrive, and for all of us to continue to develop, it's important to try and have as much of a positive spin on things as you can. So when things don't go the way that you want, what have we learned? How can we grow from this? How can we make sure if this situation was to happen again, we're going to deal with it better? What worked well this time? What didn't work well this time? So that no matter if it's a negative or a positive experience, the outcome's still going to be positive for everyone involved. I think it's really important too.
I think that's a really crucial step, because we've got different levels of experience, age, different generations that are working under our roofs at any one time. And not everyone, like to people who are more experienced, they go, yeah, this is how we problem solve. This is how we improve and get better. We look at what happened and then have a think, well, what did we want to have as the outcome? And then what could I have done to contribute towards that better outcome to occur? But young people don't, or less experienced team members don't have that thought process. And so when you make it more of a team discussion environment, you're not just getting a better system moving forward, or if this happened again, we can do it this way. You're actually training all the other team members in this is helpful thought progression to improve.
Yeah, absolutely. Yeah. So thank you, guys. I can see we're heading up to the hour. Thank you both for inviting me on. I've loved this conversation. So if anyone has any questions, obviously you guys are all in here. If you're wanting any information from me, you guys can pass on my details. Because I'm having a baby, I'm not really in this space actively right now, but come kind of a quarter of the way through next year, I'll be coming in and sharing more of what I'm talking about on here with practices, probably with you guys as well. And we'll do.
And what's your company name again?
Legacy Horizon.
That's right, Legacy Horizon. I'm going to quickly bring that up.
Yeah, legacyhorizon.com.au. And my email is huti@legacyhorizon.com.au as well. So if anyone has any questions or wants to know more, I'll be doing more things in surgery next year once family life calms down a bit. But up until then, just if you have any questions, feel free to email them to you guys. You guys can pass them on. And I'd love to come back and have another conversation about something else to do with this kind of stuff.
So, Huti, can you tell everybody what you can offer to dental practices to help them in this kind of space?
Yeah, so I will be working with practices. The core of what I do is around emotional dynamics, right? So how do we actually openly communicate in a way where everyone feels like they're heard, where we have a clear end goal and we can work towards their goal, working with culture specifically, and how to get more cohesive teams. But on the other side of that, there's the strategy that happens with practices like you guys will have when it comes to, I was a hygienist and therapist, and the role that the hygienist plays in a practice is far more than just oral hygiene. Working with the dentist and being able to support them in selling what they're selling when it comes to treatment is something that you can do. and it adds to the support of the practice. It's backing up what the dentist is offering, and it's making the patient hear the same message that you both believe is going to be the best outcome for their health, while leaving the decision up to them. So strategy around that is really important, and the effects that actually having poor culture has on your bottom line, on your mental health, on the community, on your ability to maintain staff and not lose them, but also to keep patients coming back, saying things like, I don't want to see anybody else. I want to see this practice. Because, and not just, it can be specific to the dentist, but I think what's more empowering for a practice is they want to come to the practice as a whole, because that's then, if the dentist isn't available for some reason, they're going to keep coming back to the practice. So that's what I'll be doing next year. And more coaching as well, if that's wanted, with the practice owner, maybe dealing with some conflict resolution techniques and strategies that you can do in surgery as well, and working through real case scenarios so that you know what to do when these things pop up.
Yeah, and it's just such an important thing. And whenever I'm trying to encourage dental teams to see the value of doing more than just clinical training and doing this culture stuff, value stuff, etc., is just have a look. And down here in Melbourne, of course, I'm all about AFL football, but look at any sporting team and they can have all the skills in the world, but if they don't have a caring attitude towards each other, if they don't have a good culture, if there's problems with the board members up the top, all of these other elements will make sure that they do not have a successful season. It's not just about the skills of the people involved, it's about how things are being done in that particular group. And Richmond Football Club has been on top of the ladder over the last number of years. And every time they've won one of their grand finals, I read all about it because I love wondering and discovering how these sort of elite teams can get better and better and better and be at the top of the heap sort of thing. And I'm always astounded by how many of those team members say, oh, that coach really brought in a culture of love and care, and we're here for each other, and I die for my fellow teammates. And it's those elements that when you get that right with skill, you can achieve just about anything you want.
Weren't you, Huti, the OHT for the Richmond Football Club at one point?
Was I? I might have been.
I think you were.
We had some pretty, and I would say big in Australia, people coming into that practice for sure. I was going to say,
well, we worked there, so it was understandable.
Yeah. I was going to say something about what you said, Julie. I loved everything that you said then. And, something that I've witnessed over, whether it's been a really toxic practice that I learned in any situation I love to learn. So the practices that were really toxic, I noticed specific things that they would do. And the priorities, it's always, for me, comes back to the owner of the practice, just like schools, the principal of the school. But also something that isn't always thought about is what everyone's eating in the practice. I know you can't control what people eat, but the practice that we were at, Amina, people there ate really healthy and they were physically active and they were looking after, health was an actual value of theirs, right? But when I've worked in practices where health wasn't a value, they were literally drinking Red Bull before 8 o'clock in the morning. They had lollies and chips on the desk by 10 o'clock. By 2 o'clock, the wheels fell off. Yeah. Everyone was stressed. There were tears. It was very dramatic. And the culture wasn't a priority at all. It was, and to see the differences between that having its effect. I mean, the pillars of what's important to us is, sleep, nutrition, feeling part of a community, feeling connected, all those things. The core thing, the more simple we look at this kind of stuff, the better. And asking someone, how did you sleep last night? Or can I make you a drink? Or just, I don't know. I think the more simple we make it, the better. Yeah.
And the leader in that practice, Huti, when it came to health, he was very holistic from that point of view, wasn't he? He rocked up in his bike shorts, jumped off his bike every morning, and he was a fair bit older than the rest of us.
Yes,
so for his age, he was a gun when it came to all of those things. Wasn't a very active person.
Yep.
And he did set an example like that as well.
Yeah, I remember going there and the contrast between that practice and some other ones that I've worked in, and the effect of that is really, really huge. So working with practices, the owner really sets the tone, and whether they're very active and in their being the leader, or if they're actually really repressive and hiding in their surgery or their office and letting other people run it. Yeah, it says a lot about the practice.
It does.
Well, thank you, Huti. Sorry, Meany, go.
No, it was so great to have you. A lot of these topics are just things that need to be more widely used, spread, learned amongst the dental community, we feel, or I feel. So we thank you very, very much for your time.
Oh, you're welcome. I've loved it. And I know being a part of a practice, when you hear about all of the different elements of it, I would love this to become more a part of, as important as infection control is.
Yeah, nice.
Yeah,
that's a lovely goal. That's beautiful. I like that.
Yeah.
Also, thank you all who turned up. We had 80 registrants, and we had, I think at the top it was 22 or 23 people turn up. Do turn up. It's a wonderful opportunity to be in that energy. Ask questions if you would like to. Everyone will be receiving a recording, though. There's no dramas with that whatsoever. And the links to Huti's website will be in there too, and you can contact Huti anytime. But if you've got fantastic ideas on what you've implemented in your practices to help raise the level of professionalism, have everyone be on that same page, but also be able to manage stressful situations well, we'd love to hear about those sort of things, and we can add all those things into our follow-up email as well if you get on your bike and let us know what your bits and pieces are. Lovely to see you, Ainsley. A big thank you there. Thank you, Andrew. You're such a superstar. You do so much learning. I love it. And we look forward to seeing everybody next time and see much more of Huti after the birth of her baby. So just get that baby thing happening so you can come back in the dental world and coach us through it all.
Working on it. Thanks, guys.
See you later. Bye, everyone. Have a fantastic afternoon.
Bye.
Bye.